All right. It looks like we've got a few people have joined us. So yeah, we'll start now. Welcome everyone. So this is our webinar on accessing the My Health record. It's going to be fairly quick. We should be done within the half hour. If you do need to leave and you wanted to get further information, please reach out to us. Our email is at the end of this slide, and we'll make sure we send out a copy of these slides to everyone that has joined us. So you can certainly get in touch and we can help with whatever questions you might have. Yep. So my name's David. I'm with my colleague Yelena, and we are digital health officers with Adelaide Primary Health Network. So we can help with the process of getting registered for My Health Record, and also we can deliver some training on how you should be accessing it and how to access it. So this webinar will go through, I suppose, how to access it using conformant software. So using software that has, I suppose, been registered with the Australian Digital Health Agency that meets its guidelines on accessing My Health Record correctly. And we'll also go through, if you didn't have conformant software, you can access it through the provider portal. So we'll go through sort of examples of those. Before we start though, we would like to acknowledge the Kaurna peoples, who are the traditional custodians of the Adelaide region. We pay tribute to their physical and spiritual connection to land, waters, and community, enduring now as it has been throughout time. We pay respect to them, their culture, and to elders past and present. We'd also like to acknowledge and pay our respects to those Aboriginal and Torres Strait Islander people from other nations who live, work, travel, and contribute on Kaurna country. Mani ngā puni, welcome. Okay, so just a brief overview of My Health Record. So it's an online summary of an individual's health information, and it's personally controlled. So those individuals are able to control who has access to their My Health Record, and they can remove anything from it. So they can remove individual items, or they can delete it in its entirety. It's a national system, so can be specifically useful for patients that you've never seen before, or perhaps interstate travellers that are coming in where no one has access to their health information. Perhaps they are self-referral as well. The data within My Health Record is going to be well protected, and all access is recorded. These are documents that can be found within someone's My Health Record, so not all of these will be within someone's record. Some of these documents require the GP to upload it manually. And some documents are uploaded automatically. So I suppose the Medicare documents, AIR information, that's all uploaded manually. As we go through the software, we'll go through examples of what those looks like. But as a healthcare provider, the only way to access My Health Record is to have conformant software which identifies you by a unique identifier, or you can access it through the provider portal, which uses your Proder account to identify you. At this stage, the only way to upload information is through that conformant software. So if you're using the provider portal, you're only allowed to download and view information as opposed to uploading it. Patients are able to upload some information, however, this will be fairly limited in its clinical use. Everyone has an individual healthcare identifier, or IHI, and this is needed to access someone's My Health Record. So I've included this as it's a common issue for not being able to access someone's My Health Record. If one of these 5 items isn't recorded or recorded correctly, then in most cases, this is the reason why you can't access the My Health Record. So we'll talk about this as we go through an example, yeah, just worth keeping an eye on. So we've identified MMX and Mastercare as being common software that are used within community health organisations. There are a long list of conformant software. These are the only two that we're going through, but even if your software isn't one of these two, yeah, I think it's still worth having a look at how these programs access it, because it's fairly similar between programs. There's common themes. So starting off with MMX, you're able to view the status of the My Health record here. So that indicator, when it's green, you're good to go. When it's orange, it means that the patient does not have a My Health record. And then red means that there's an error. So one of the causes of an error is that a patient has set an access code to their My Health record, which means that you need to ask them for that code and then enter it in. So on the right there, it says gain access for code. That's what you would select and then enter in that code. And that will be similar between different software as well, where it asks for a code. And there will also be a button there that says gain access by emergency. And yeah, we'll talk about that a bit later on. If there was no IHR recorded or identified, then selecting verify IHI will take you to this next page where you can make sure that you've got those 5 items recorded. So first name, last name, date of birth, gender, and then Medicare card number. So it will give you a bit of a guide through this one if the healthcare, the IHI has not been found, and then you're able to select search for IHI number and status if that's not in there. So to view clinical documents with someone who has a My Health record, we can select My Health record there. We're then taken to a document list that will show a list of documents that exist within the patient's record, their My Health record. So this example shows some shared health summaries and an event summary in the order of when the document was created. The event summary is a document that we believe a community health organisation will most likely upload. So we've got an example here, yeah, essentially looking down the bottom, we can sort of see that this example is essentially some progress notes. So just what they've had a free text entry with, yeah, this is the kind of thing that you can upload as a event summary. So the next page after the document list is author of document, and here you can choose what information is uploaded. So if we stick with an example, an event summary, within MMX, you're able to upload a progress note. So selecting on event summary takes you through to this page, and then scrolling down shows a list of your progress notes where you're able to upload information that you think will be beneficial to other healthcare professionals involved in your patient's care. So it's a good spot to upload information that you think their GP might want to know about. And yeah, there might be some information from other health professionals there as well. The Medicare Overview will show all information that's received through Medicare and the Australian Immunisation Register. So MPS, PBS information can be viewed here, along with a list of immunisations. And as we can see there, we can select timeframes that we want to view those in as well. The prescription and dispense view collates recent medication that has been prescribed and also dispensed. Again, it's important to note that a patient is able to delete anything within the My Health record. This may not be a complete picture. There's a potential that they have deleted a single dispense record or a single prescription record or something like that. So just worth keeping in mind. And that final observation view is where it will show patient uploaded information, which they might have uploaded an allergy or height and weight, but a patient's shared health summary, that's going to be where you're going to get the most information about somebody. Essentially a GP might upload it and it's going to take a bunch of information from the software and automatically plug it in. So it's basically going to be whatever's in a GP's software that's recorded will be uploaded in a shared health summary. And Mastercare, so this one's a bit simpler in how it's accessed. Yes, it has a similar troubleshooting when you can't identify someone by their IHI. However, just within clinical notes, there's a My Health record tab there, and that will show a full list of documents that have been added to a client or patient's My Health record. It's worth noting any commissioned service provider of Adelaide Primary Health Network that do use Mastercare, unfortunately, that's not a conformant version. However, if you're privately accessing Mastercare and do have a conformant version, then that's going to have the necessary IT behind it, I suppose, to be able to register for My Health record and then view it. So I'll pass on to Yelena, who'll talk on the National Provider Portal.
Thanks, David. So accessing the provider portal is pretty easy once you are all connected in PROTA. So you will need to log in using your PROTA details. And if you don't have a PROTA account, you can click on Register Now and follow the steps to create one. And once you log in, if this is your first time logging in, you will need to link your PROTA account to the My Health Record system. And to do so, you'll need to enter in your HPII and click Next. This step only needs to be done once. So for all future access, you will just need to log in. Then if you are linked to multiple organizations, you'll need to choose the organization you're representing, which will be where the patient is receiving their care. And if you don't see an organization listed, you'll need to contact the organization's OMO to be added in. So now you can search for a patient's record, and just like in conformant software, you'll need the following information to find and access a patient's record, and that includes their last name, date of birth, gender, and an identifier. This can be an IHI, a Medicare number, or a DBA number. And just like in conformant software, they may have restricted access to the record, and so if they consent to you accessing their information, they'll give you an access code. You can access via emergency access, which uses a break glass method. This function is closely monitored and is recorded in a patient's record. So now we have the provider portal dashboard. As you can see, the patient's information is up on the top left with a navigation menu. The first tab shows a health record overview, which shows a snapshot of the patient's health information, and it shows all documents available since the last shared health summary. To open a document, you will just click on the document name and it will display the same as it would through clinical software. For a list of the patient's clinical document types, you can click on Clinical Documents in the navigation menu. And from the drop-down menu, you can select the document type you are looking for. For example, if you select Shared Health Summary, all the shared health summaries uploaded will be listed. And it also shows the date of upload, the author of the document, and the organization which they are associated with. So next in the navigation menu is the medicine records tab, and here you can find the most recent medicine information that has been recorded. The drop-down menu shows allergies and adverse reactions, prescription and dispense records, and a Medicare overview. So here is just an example of the prescription and dispense records. You can expand the menu for the medicine, and you will find the prescription date, the medicine details, the date it was first dispensed, the last date it was dispensed, and how many refills are remaining. You can also filter by date. So if you are looking for something from a few years ago, you can put in some filters to get the exact data that you're looking for. Next, we have consumer documents, and this is where the record holder can add any information about their health. So this is added into the personal health summary and can include information such as allergies and adverse reactions, list of current medications, and any key contact information. Then moving forward, if available, the next tab will show child development. You can find the child's growth and development information, including health observations, immunizations, health check schedule, growth charts, and some information for parents. Then we have the Medicare Overview. It gives you access to Medicare information, including medicines dispensed and claimed through PBS and RPBS, information from the AIR and AODR, and Medicare services, including MBS and DBA items. Then the last tab on the navigation menu is the Advanced Care Planning. Here you can find advanced care planning information. And if a patient has an advanced care plan, you can click on the document to view their wishes. So the last function of the provider portal is the search button. If you're looking for a specific document, you can click on the magnifying glass to the right of the navigation menu. And this brings up a page where you can filter by document type, document status, date, or author. And then to close the record and open up a new patient, you will click on close record on the top right, and it will take you back to the search menu. So these are the main key functions of the National Provider Portal. There is a training platform created by the agency that we'll send out in the email following the webinar. And it's a good resource if you want to go onto the platform and test different patient scenarios and get a feel of what the provider portal looks like from your perspective.
Excellent. And yeah, so here's just some extra information if you wanted to get in touch with us. There's a number there for My Health Record, which is particularly useful if you had any questions about the provider portal or something like that. And there's also contact details for the Australian Digital Health Agency there, who oversee My Health Record. So yeah, that's all we were going to go through today. If you do have any questions, be sure to put that in the chat box. Otherwise, yeah, give us a call, and we can go through any questions that you might have. So looks like we have one question. And that's so yeah, who can access the My Health Record, and essentially the answer there is any healthcare professional. So if you're a practitioner that's registered with APRA, then you will be able to access it. And then a member of a professional association as well. So I suppose, for an example, a social worker who is registered with their peak body, they are able to get the necessary, I suppose, information to then access My Health Record. And you also need to be working within a organisation, a healthcare organisation as well. So yeah, there's a few things you need to do prior to accessing My Health Record. So yeah, if you have any questions or perhaps you're not sure if your organisation can access My Health Record, then yeah, let us know. We're happy to walk you through the steps. We're also able to conduct training for you as well. So a requirement before you access anyone's My Health record is to do some training. So this training can be through the Australian Digital Health Agency. They have a training platform that you can use, or we're also happy to come out and deliver some training as well. So yeah, there's I suppose quite a lot of information that we haven't gone over in regards to My Health record. So if you wanted to have a meeting for an overview, that's fine as well. As I said, any information, just let us know. Great. Well, I might just, we might stay on the line for a couple of extra minutes, but in lieu of no questions, thanks for everyone for tuning in. As we said, we'll send out some information for everyone that's joined, yeah. Doesn't look like we have any more questions, but yeah, thanks again for tuning in. As I said, get in touch with us if you had any questions. Otherwise, yeah, enjoy the rest of your day.